Anecdotal evidence shows that there is growing cancer incidence in Nepal. According to World Life Expectancy 2012, Nepal ranks 9th and 10th on oral and ovarian cancer respectively. Certainly, the burden of cancer to national health care is exacerbated by lack of adequate hospitals. But more importantly, the front and center of cancer treatment, diagnosis, is not only limited in Nepal. Majority of pathologists are not well versed in more specific differential diagnosis of cancer using techniques like immunohistochemistry. Most of the pathologists in the country are making primary diagnosis based on morphological characterization only. The challenge of cancer diagnosis was well recognized and realized, but nothing substantial was happening until a locally based diagnostic laboratory, Intrepid Cancer Diagnostics (ICD), started exploring ways to address this gap. Enhancing cancer diagnostic capability in Nepal had two inherent problems: lack of laboratory infrastructure and trained human resources, pathologists and laboratory technicians. There is only a handful of pathologists who are trained on immunohistotechnique, which is most widely used method to do accurate diagnosis of various types of cancer. Keeping these two challenges in mind, ICD partnered with Dutch Cancer Diagnostic Development Fund and the Department of Pathology at Maastad Hospital of the Netherlands to build state-of-the-art cancer diagnostic laboratory in Nepal.
क्यान्सरको लागि चाहिँ रुटिन स्टेन जुन एचएनडी स्टेन भन्छौँ रुटिन स्टेनमा मात्रै भर पर्नु परेको छ। त्यसले चाहिँ यो क्यान्सर हो अथवा होइन अथवा बोर्डरलाइन हो र कहिले कहिले चाहिँ बिनाइन ट्युमर जुन चाहिँ नफैलिने खालको क्यान्सर होइन त्यो खालको ट्युमरबाट मलिग्नेन्ट ट्युमर जो चाहिँ क्यान्सर हो त्यसलाई पनि छुट्याउन गाह्रो भइरहेको हुन्छ। अनि क्यान्सर हो होइनले मात्रै चाहिँ अहिलेको जमानामा ट्रिटमेन्टलाई क्यान्सरको ट्रिटमेन्टलाई चाहिँ अप्ठ्यारो परिरहेको हुन्छ, किनभने हरेक किसिमको क्यान्सर पनि धेरै थरीको हुन्छ र कुनै एउटा अर्गनको क्यान्सर भन्ने बित्तिकै सबैको एउटै ट्रिटमेन्ट हुँदैन। त्यो क्यान्सर पनि थरीको हुन्छ र त्यो थरीको क्यान्सरलाई चाहिँ राम्रोसँग छुट्याउनुको लागि चाहिँ यो टेक्निक चाहिँ अपनाउनु जरुरी छ र यो टेक्निक चाहिँ अहिले यहाँ आइसिडीमा चाहिँ सुरु भएको छ र यो चाहिँ पहिला चाहिँ यो टेक्निक को लागि चाहिँ हामीले इन्डिया पठाउनु पर्थ्यो केसहरूलाई र यो चाहिँ अब यहीँ नै हुने नेपालमै हुने भएपछि अलिकति छिटो भरपर्दो हुने भएको छ।
ICD has two key objectives: offer highest quality cancer diagnosis in Nepal, provide quickest turnaround time on diagnosis report delivery. ICD's pathologists and laboratory technicians received training at the Maastad Hospital in the Netherlands, and subsequently, experts from the same hospital visited ICD to make sure all quality assurance checklists were ticked off.
Two cases here today, and the first case is a 29-year-old lady who presented with uterine bleeding. So there was a uterine curettage we received in histopath. This is a very interesting case, and this is the paraffin block from the lady. Now the same lady, after like few months, she presented with epistaxis. So she was brought to the ENT department and she came with epistaxis. So the nasal packing was done and they suspected hemangioma, septal hemangioma. So biopsy was taken and then sent for histopathology, and there we found that there was metastasis from the uterine, the same primary tumor with metastasis. So we gave it as positive for metastasis.
What is of a 26 years old female, and she presented with an ovarian mass, and this case was brought to Nuclear Hospital from Tansen, Pampa, and in ultrasound they said that it was diagnosed as a mucinous cyst adenoma, but when she was operated in our hospital, they doubted the diagnosis, and when it was sent for the histopathology, we saw that rather than a cystic mass, it was a kind of solid mass, and there were few mucinous components in this, and in diagnosis we had kept it as a mucinous adenoma, and our second diagnosis was some kind of stromal tumor, either sclerosing stromal tumor or fibroma or thicoma. So now to confirm the diagnosis, we have done the case here in immunohistochemistry.
Big as I would expect in the cholangiocarcinoma. But it is a possibility, definitely, especially in this.
But one of the main technological advances that ICD invested was its telediagnostic capability. ICD is one of the few labs in South Asia region to have digital histopathology capability. By having this platform, ICD can directly share histopathological images to do consultative diagnosis between Nepali and Dutch experts. This greatly enhances Nepal's capability to offer swift, high-quality cancer diagnostic services. The cancer telediagnostic capacity also allows various pathologists from different corners of Nepal to get direct training from experts from ICD and the Dutch hospital. The only prerequisite is availability of internet connection. Pathology and diagnostic-related case discussion and consultation is now possible, connecting pathologists from Bhaktapur to Bharatpur. Additionally, ICD has developed online software that allows pathologists to directly view diagnostic progress on their cases, significantly cutting time of receiving reports. Since its operation from the middle of 2013, ICD has provided cancer diagnostic services to various hospitals and mainly difficult to diagnose cases. Average diagnosis time has been cut down to less than 5 days, which often means there is extra time for early treatment interventions. ICD has also started molecular DNA-based cancer detection, disease progression, and treatment effectiveness monitoring services.